My long-term community rotation was 4 weeks at AFAN, Aid for AIDS Nevada, with Mandy Waiters, the registered dietitian. AFAN serves a population of individuals infected with HIV and AIDS living in a low socioeconomic bracket in the Las Vegas Valley. AFAN is funded by the Ryan White Comprehensive AIDS Resource Emergency Care Act, which passed in 1990. The Ryan White HIV/AIDS program was created from this act and is administered by the U.S. Department of Health and Human Services within the HIV and AIDS Bureau. The program provides medical care to improve health outcomes and decrease the transmission of HIV in infected clients. The Ryan White Care Act provides many services to people living with HIV, ensuring that they remain in medical care and have easy access to said care. It is estimated that over 1.1 million people are living in the United States with HIV as of 2018. Approximately half of these people are receiving services from the Ryan White Care Act each year. In order to be eligible for the Ryan White Care Act at AFAN, a client must provide the following information: proof of HIV diagnosis, proof of Nevada income or attestation of no income, proof of Nevada residency, insurance documentation if available, lab documents verifying their CD4 count and viral load, and they also need to be within 400% of the U.S. poverty limit. A medical referral is required to see the dietitian. In addition to nutrition counseling, the dietitian at AFAN can also provide $40 food vouchers to Smith's once every 6 months and a 3-month supply of Ensure if it is deemed medically necessary. The human immunodeficiency virus attacks the body's immune system, targeting specifically the T helper lymphocyte cells known as CD4 cells. A person with HIV is more likely to contract other infections or infection-related cancers. As time passes on without treatment, the immune system can become so weakened that it can no longer fight off these opportunistic infections or cancers. This is known as acquired immune deficiency syndrome, or AIDS. This is the final stage of the HIV infection. The virus is transmitted through direct contact of infected body fluids. This can happen via sexual contact, sharing needles to inject drugs, mother to baby during pregnancy, birth, or breastfeeding, and in rare cases, transfusions of blood infected with HIV. There is no cure for HIV. Patients are started on an antiretroviral therapy, ART, medication. The main goal of this medication is to decrease the amount of HIV ribonucleic acid in the blood. This is the viral load, until it's undetectable. If the virus is undetectable, it is untransmissible. Prior to the introduction of ART medication in the 1990s, HIV patients would progress to AIDS and then death within only a few years. Today, if HIV is diagnosed early and treated consistently, a person with HIV has nearly the same life expectancy as an individual that does not have HIV. ART meds often have interactions with specific foods and also adverse side effects, including nausea, vomiting, and diarrhea, weight loss, and also weight gain. These can be monitored by a registered dietitian nutritionist. An adequate balanced diet is essential for people with HIV in order to maintain a healthy immune system and thus prolong life. Proper nutrition has been known to aid in the maintenance of lean body mass, which reduces the severity of HIV-related symptoms. Focus on medical nutrition therapy to target common comorbidities seen with HIV. Some of these comorbidities are hypercholesterolemia, arterial hypertension, chronic depression and anxiety, metabolic bone disorders, and diabetes mellitus. The aging population of people living with HIV that are virologically suppressed and on active ART medications are more likely to suffer from symptoms of these comorbidities than they are the actual HIV infection itself. There are approximately 9,834 people diagnosed with HIV within the Las Vegas Valley. This demographic of people includes the following distribution: 28.8% Black, 31.4% Hispanic or Latino, 31.6% white. AFAN Clinic is located strategically in an area of town with a higher incidence of infected people in order to provide more convenient access to the services that they provide. The income level of this zip code is estimated to be between $0 and $45,000 a year, with 21.2% of the residents falling below poverty level. It can be demonstrated that this area of town falls within a low socioeconomic status classification. Somewhere in the range of 0 to 81% of the residents in this zip code have completed a high school education. According to many studies conducted by the American Psychological Association, a strong correlation exists between low socioeconomic status and the level of education and literacy. Through her interaction with patients, the dietitian at AFAN validates that many of the patients receiving care demonstrate both financial inability to provide food for themselves throughout the month, and they also struggle to read printed education materials due to either a language or education barrier. AFAN is grant funded in part by Part A and Part B of the Ryan White Care Program. This budget includes the dietitian's salary and nutrition-related expenses such as food for group meetings and education sessions, the purchase of food vouchers for Smiths, and the purchase of Ensure Plus supplements. There simply isn't enough money in the budget to allocate to the purchase of nutrition education models. These are the sugar content models that we created using white sugar to indicate the number of grams of sugar in 19 commonly eaten foods. Some of the foods that we included are whole milk, Oreo cookies, a Slurpee, Hershey's Kisses, and even Frosted Flakes. These fat content models were filled using coconut oil to indicate the number of grams of fat in 22 commonly eaten foods. Some of the foods represented here include a McDonald's large French fry, lean ground beef, vanilla ice cream, whole milk, and a ballpark hot dog. All of the test tubes were labeled with the name of the food, the serving size, the number of grams of fat or sugar contained within a single serving of that food. These models will stand in a test tube rack on the dietitian's desk and easy access of the clients during their session. The dietitian will schedule a 1-month follow-up to evaluate the progress of the patient's nutrition understanding and application once they're at home. The dietitian will review the client's progress in cutting back on foods with excessive fats and sugars. If significant progress has been made, we can conclude that the education using the models was successful. If progress has not been made, we would ask the client to mirror the education that they received back to us regarding the models to demonstrate an understanding of the models and how they represent the specific foods and the role that these foods have in the life of the client. Lack of progress may not be attributed to only a misunderstanding of the models, but also to a lack of readiness or other unforeseen barriers in their life. Every individual encountered, regardless of health status, is going to have their own unique style of learning. This will inevitably present barriers. It's our responsibility as professionals to acknowledge this and offer a variety of opportunities and strategies to absorb and receive the nutrition education that we are teaching. Barriers like socioeconomic status, language, and literacy should not prevent us from delivering quality nutrition education. Often, a little ingenuity, time, and effort can result in a product as good or even better than those that are commercially available.